Welcome, everyone. Welcome, everyone, to Stanford Medicine's virtual town hall on COVID-19, episode number 8. My name is Andra Blomkalns. I'm the chair of emergency medicine, and thank you so much for taking the time to join us today. Over the last 2 weeks, we've discussed the pieces and topics related to restoration and recovery for Stanford Medicine. Last week, we had a very serious discussion about what that might mean and might look like for those who make up Stanford Medicine. This week, we plan to cover what the pieces might be in terms of increasing our operations, taking care of delayed surgeries, and continuing to emerge as a preeminent institution for all healthcare needs. Today, I'm joined again with a group of esteemed panelists. Why don't we get started with introductions? Allie.
Good morning. I'm Alison Kerr, the Chief Administrative Officer for Clinical Operations at Stanford Health Care.
I'm Bill Maloney, Chair of the Department of Orthopaedic Surgery.
I'm Denny Lund, the Chief Medical Officer at Lucile Packard Children's Hospital.
I'm Norman Rizk. I'm the Chief Medical Officer of Stanford Health Care.
I'm Yvonne Maldonado. I'm Professor of Pediatrics, and I'm the Head of Infection Prevention and Control at the Children's Hospital.
Well, I'm Sam Walden. I'm VP and Associate Chief Medical Officer for Perioperative and Interventional Services.
Thank you very much. We're all looking forward to asking you questions. At this time, I'll turn it over to Stanford Medicine leadership to hear what's tippy top of mind this week.
Andra, thank you. It's great to be here with you, and I appreciate all of our panelists that have been here. I also appreciate my two colleagues, Lloyd and Paul, who have been with us throughout these 8 episodes, and we continue to make sure that as across Stanford Medicine, you get the information that you need to stay informed. I wanted to start today, as I've said before, it'd be great to be in person. We look forward to that day when that is the case. We have also had, as we announced last week, one of the programs that we've had to put in place is our temporary workforce adjustment program to mitigate some of the expenses that are coming along. I wanted to just share with you today, we know that there has been some misrepresentation of that program in the media. Just so that you understand, the program is as we described last week. It still remains to be the same. Unfortunately, what sells headlines is 20% reductions and layoffs and furloughs. It's not that we're allowing you to use your paid time off to maintain your salary and paychecks. We've had to make some expense reductions. As you know, there's a hardship when we have reduced the capacity that we have in order to prepare for what we thought would be the surge. But that has created some financial hardships on the organization. I met just this week with the board to share with them that we were not planning that we would have a profit this year. In fact, we were hopeful to break even. And all of the programs that we're putting in place are to try to get us there. What is the program? The program, TWA, allows you to make 2 choices. One is that you can use your paid time off to make sure that you get the same paycheck and salary that you have now, or your other choice, and these are your choices, you can take a salary reduction. We wanted to make sure that you had a choice. We wanted to make sure what was most important to us is that you maintain the pay that you receive now. Now, what have our employees chosen? This actually started this Monday. 99.5% of all of our employees have chosen to use their paid time off to maintain their paychecks. That's where the facts are. And despite this being misrepresented in the media, we want you to make sure that we know that what's important for us is that your salaries are maintained. Now, we also know that we continue to see, and you heard last week, some of the things that we're doing to try to be able to get the business that we have back up to care for those patients who have needs. And you're going to hear more about what is happening actually today. I'm pleased to report, in fact, we have 422 patients in our hospital today, which has increased dramatically. We've had a 10% increase in our ED volume. And in fact, you're going to hear about the surgeries that were delayed. We had close to 3,000 that are now getting rescheduled. That really is the upside to what we need to do to get back on strong financial footing. We appreciate all that you do. We appreciate the work that you do every day to care for our patients. We know that that's very hard. We know that this TWA has an impact on you, and we want to make sure that we're sensitive to that and you understand that this isn't easy, but it will allow us to come through this even stronger. And the reality is we will come out of this stronger. thank you for what you're doing. I want to close just by announcing that we just learned that, again, we received an A on Leapfrog. It's great quality across the organization. Thanks for all you do. With that, let me turn it over to Paul.
Thank you, David. Like David, I want to welcome you back to this weekly series of information sessions that we provide. TWA, Temporary Workforce Adjustment, as we shared with you last week, this is something that we believe is shared burden, and it applies to all of us. As a matter of fact, just yesterday, I had another TWA PTO day myself. You've heard us talk over the last 8 weeks about how Stanford Medicine has come into this crisis from a position of strength and the assets that we have to deploy to this crisis. The best asset we have is all of you, our people. Our people are our strength, and you're the reason we're going to come through this crisis on the other side even stronger. We have been having some listening sessions with many of you over the last week or so with the announcement of our temporary work adjustment program. One of our colleagues in food service shared with us that he didn't feel that he was essential to his job, but he was essential to his family in terms of ensuring take-home pay. I would disagree with him on one point that he made. He is essential. All of you are important. Each of us play a role in terms of carrying out our three-part mission. Some of us are closer to the patient than others, but in all and in total, each of us play a role that's vitally important. And if we can get through this process, remembering that as a guiding principle, I think we'll be great and better on the other side. Lloyd.
Thank you, Paul. I want to echo David and Paul in thanking you for the work that you're doing every day. This past week, we received an encouraging update and announcement from Governor Newsom asking hospitals in the state of California to resume providing care for many procedures that had been delayed or deferred in the past. This is an important announcement because we know that during these past 7 to 8 weeks, we've really put a lot of healthcare and healthcare delivery on hold. And if we don't get back to providing that care to the people who depend upon us for the care, it's going to have adverse health consequences for a long time to come. As we've talked about before in these sessions, we've moved from preparing for the surge to focusing on recover, restore, and reopen. And part of that process, an integral part of that process, is to make sure that as we bring clinical operations back online, we continue to protect your safety and your well-being. We're doing that through the PPE we're providing. We're doing that through the way that we're organizing visits and procedures, as you'll hear about in just a moment. And before turning it over to Andra to lead us in our panel, I want to, on behalf of all of us, shout out a word of thanks to the members of our Procedures Operations Recovery Team, or PORT. PORT has been working around the clock to determine how we can bring healthcare services back online, as we now know that, at least for the time being, and we hope for a long, long time, we're not going to experience a surge in patients. PORT is concerned about your safety and is also concerned about enabling us to provide care to the people who depend upon us for their care. Finally, we're all so proud of your response over these past weeks. You've far exceeded any of our expectations. On the other hand, we're not at all surprised given the quality of the people who work here every day and who devote their lives to providing care for others. Now let me turn it over to Dr. Andra Blomkalns, Chair of Emergency Medicine.
Thank you so much. So now we'll turn our attention to the pre-submitted questions from earlier this week. The first question goes to Sam and then Alison. What sorts of delayed procedures are we going to resume and when, and how might that differ between SHC and SCH?
Thank you, Andra. So we have several thousand patients who are delayed or canceled and are now in the process of being rescheduled at both Stanford and at Packard Children's Hospital. We're working through that list, ensuring that we have all of the appropriate safety equipment to keep our healthcare workers safe, testing patients as much as we can, and also part of the healthcare worker testing program to keep our patients safe. We'll be working through that list, specifically looking for patients who might be at higher risk for a problem if they got COVID-19 and holding off on those patients, but looking at the patients, as Lloyd mentioned, who may have an increased disability or medical problem as a result of being delayed. We'll be working through that list together in a reasonable cadence, the same at both Packard and Stanford, hand in hand together.
Great. Allie, do you have anything to add?
I do. Thank you, Dr. Walden, Dr. Blomkalns. I just want to give you all, as well as the community, great confidence that this protocol that Sam talked about is very well intentioned, it's evidence-based, and we've been very thoughtful in terms of how we're bringing care back to the community, keeping protection of our staff and our patients at front of mind. Thank you.
Excellent. Bill, how confident are you that volumes will return, and what do you think patients and providers are feeling right now?
Yeah, so the short answer is that I'm quite confident volumes will return. As Sam said, we have had several thousand cases across the institution that have been postponed because of COVID-19. In orthopedic surgery alone, we have about 1,200 cases that were either scheduled or postponed or never got on the schedule. So for the last 3 days, we've been calling those patients back, and about 85% or so are anxious to get back on the schedule. The other 10 to 15% are a little bit more timid about it and want to wait. They still want to have their surgery, but want to see how the next couple months roll out. As it relates to the outpatient setting, we've been putting that off as much as possible. We've been using virtual visits, but coming this Monday, we'll ramp it back up again. We have 209 patients scheduled in the Redwood City facility for orthopedic surgery. 65% of those will be virtual visits. A normal busy Monday is about 400 visits, and we anticipate we'll be back to that in 3 weeks.
Thank you. Norm and then Denny. How do we plan on keeping healthcare workers safe as we resume normal operations, and are healthcare workers going to be tested?
We have a variety of measures to ensure the safety not only of our healthcare workers, but also of our patients. It starts with testing, testing, testing. In the last 10 days, we've actually tested 10,000 asymptomatic healthcare workers of our entire workforce that amounts to about 14,000. And we've discovered well under 1%, exactly 0.4% of 1% of our asymptomatic healthcare workers seem to have an infection. They, of course, will have their care provided by our occupational health services, but will be quarantined and retested before they're let back in the environment. In terms of our patients, we intend to test all inpatients, whether they come from the emergency room, from electively for a procedure, or from the transfer center, so that we know that everyone within the hospital has been tested and is safe. And the ambulatory services will also be testing everyone prior to having a complex imaging procedure or a procedure that requires going to the operating room. There are a variety of other measures, of course, that we've implemented to ensure the safety of our internal environments. These start with access point control, so we screen for symptoms before people come in. There's a publicly mandated no visitation policy so that we don't have people that are not tested within our environment. We have universal masking, of course. We also cohort the few patients that we do have that have COVID-19. Yesterday, we only had 9 patients in the hospital that were positive, 8 of them on a single ward and 1 of them in the ICU. We have and continue to maintain robust supplies of personal protective equipment, and we're monitoring it in all sizes at all times to ensure that our healthcare workers are well protected. And since we know what the infection rate is, well under 1%, we know that our personal protective equipment is working. So what we really intend to do is create a sanctuary from the virus in the interior of our healthcare world. For the external world, we are measuring the prevalence in the community and doing that in conjunction with public health authorities. That will help us know when we might need to retest all of our healthcare workers. But the variety of measures that we have, I feel confident will ensure the safety of people that need to have their deferred care provided.
Excellent. Denny?
Thank you, Andra. I just want to reiterate what Dr. Rizk has said. We've been in this pandemic now here in Northern California for about 6 weeks, and both Lucile Packard Children's Hospital and Stanford Health Care have actually cared for COVID positive patients. And in that period of time, we have done extensive contact tracing, and there has been no evidence of transmission of COVID from a patient who was infected to any healthcare worker. And that's because we've really learned how to care for these patients in a safe manner. And that's hand washing, social distancing, proper use of PPE, and we will continue to use these measures moving forward. The thing that we've been able to add more recently, as Norm points out, is a lot of testing and testing our healthcare workers. Again, reassuring ourselves and our patients that the incidence of COVID in the healthcare working population is extremely low. So we will continue to follow these measures moving forward and track our PPE stores and our testing availability as we ramp up our procedural activity.
Great. I just wanted to turn, just to ask Norm one more question. So number one, 0.4% seems like a really awesome low number. And then there's the high number, 10,000. As we watch 10,000 healthcare providers that have been tested. So as we watch the media and the news and those sorts of things who can't even get testing for symptomatic patients, how in the heck did we pull off testing 10,000 healthcare workers?
Well, we're very fortunate that prior to the pandemic becoming very large locally, some of our physician scientists developed our own testing mechanisms. And so we were able to scale up in our laboratories in the pathology department adequate testing, not only for ourselves, but for other community hospitals, academic centers, health maintenance organizations. And at this juncture, we have both serology and testing for the RNA of the organism that's available, and we're making it available to the community.
Wonderful, thank you. Bonnie, is resuming these delayed procedures going to cause a spike in COVID-19?
Well, you just heard from our leadership how safe the environment is here at Stanford. In fact, as you heard, we are a haven that we think will continue to be the case. We are protecting our patients and our healthcare workers from infection within these walls. But equally as importantly, we're keeping track of what's going on in the entire Bay Area, tracking infections around the Bay Area, looking for hotspots, keeping that information up to date with our public health officers around the Bay, and making sure that we understand those data here so that as the governor loosens restrictions, we know whether we should be adjusting our policies within the hospital as well. Now, you will hear as time goes on in the communities around the Bay Area, California, and around the country that there may be some evidence of increased infections, hopefully not many, but we know the virus isn't gone, and we don't know how long it'll be around. So we need to keep practicing all of the things we're doing here at the hospital to make sure that we keep that virus out of our hospital unless we're bringing in infected patients for therapy. So I'm very confident that we will be able to keep that same high level of safety that we've had and also inform our communities to help them understand how to do the same thing.
Great, thank you. Lloyd, Governor Newsom recently announced that hospitals could resume delayed health care. At the same time, the shelter-in-place order is also being extended. Is that a contradiction?
Thank you, Andra. I don't think it's a contradiction. As we just heard from Denny and Norm and others on the panel, we're doing a lot, and we're going to continue to do a lot to protect the health and safety of healthcare workers. But all of us in the healthcare delivery system need to remember that when we're not working and delivering care and working in our environment, we need to continue to observe shelter in place when we're outside of the work environment. That will keep us safe outside of the work environment. As you've heard, we're doing a lot to protect the safety of our workers in the healthcare delivery system. But there's a big world outside of the delivery system, and there we still have to observe the shelter-in-place guidelines that thus far have done an amazing job in protecting all of us in California from the types of surges that have been so devastating in places like New York and in Italy. And of course, when we're in the work environment, we're using appropriate PPE and we're providing the care to patients who depend upon us for that care.
Thank you. David, what's going to happen to virtual care after this crisis, and how will digital health be a strategy for our recovery?
You know, I think digital is really one of the bright spots that we have that have come out of this. If you look at our ability to still provide care, think about it. We've gone from 2% of our visits being used telehealth-wise to over 70%. As we talk about ability to continue to provide care and not spread the disease, this really becomes one of the things that I hope that we see continues to grow. And also, if you look at our emergency department, it's allowed our providers to be able to talk without face masks on to our patients in a way that creates a different experience for them. So there's so many applications of digital and technology in our healthcare provision that we probably haven't even seen yet. So I do hope that we continue that.
Great. Paul, how is Stanford Medicine preparing for an expected surge this fall and winter? And are we continuing to acquire PPE, testing supplies, and the things we might need?
Thank you, Andra. Several weeks ago, when this crisis first fell upon us, we stood up a hospital incident command system that we call CORT, a Clinical Operations Resource Team. The leadership of that process is our two medical officers, Norm and Denny, that you've heard from so far this morning. We believe that that process is working very well for us. It addresses all of the issues you've just mentioned in terms of PPE, safety, surge planning, facilities, and all those other concerns that we may have. To the extent that we don't have a vaccine yet for this crisis, we expect that process to continue well into the fall. And so we think that that process serves us well. Thanks, Andra.
Thank you. The next question is mine, what is happening to ED volumes, and do I expect them to increase? So our volumes have been down over the course of this crisis, roughly 40 to 50% of what we were previously. The good news is we've been up about 10% over the last week. I'm tremendously confident that it's a safe place to be, and we want people, if they need health care, to come to the emergency department. We will be there for that health care. I feel optimistic about the 10% increase, but I ask for the help of the community to spread the word that we're a safe place to be and we're there to take care of them. At this point, we'll turn our attention to the live submitted questions. And let's see, the first one goes to David and Paul. Friends are reaching out to me after seeing news stories that claim Stanford is mandating pay cuts for frontline healthcare workers. It's embarrassing. What are you doing to set the record straight?
You know, one of the things, as I alluded to earlier, what sells newspapers is different than sometimes the reality of what actually occurred. We know what we've done as an organization to have 99.5% of our employees have no reduction in their pay. That, I think, is the message that we need to share back. That's not what the media is sharing. I, in fact, spent multiple periods of time talking with reporters and even doing on-camera interviews, and the takeaways from that were still that 20% reduction. And so I hate to say that it's misrepresented, but I don't know that the folks that are actually sharing the media are going to get it right hopefully soon, but we keep trying. So we'll keep trying to make sure the messaging is right.
Just adding to that response, thank you, David. David and I also have been in close communication with some of our elected representatives who've also been sort of contacted about this policy that we've implemented. The best thing that we can do to set this record straight is to share very transparently what we're doing, as David did at the top of the hour. It's also important that our employees also weigh in when they're asked about this in terms of, has your pay been cut 20%? The answer to that question is resounding no. To the point of the question, we do plan to step up our communication to the general public in terms of what we're actually doing to address this misperception that's out there. Thank you, Andra.
Great, thank you so much. To Denny and then Norm, will a large portion of our workforce take PTO as part of TWA, and will that affect the quality of care that we're known for? Denny?
That's a very good question, and this is something that we really have rolled out with our PTO TWA plan. Is we do not want this TWA program to affect the quality of care, or very honestly, the access to care that patients may need. So this is a dynamic program that's being actively managed on a day-to-day basis based on the needs of our patients, very honestly. We want this program to help us to reduce our expenses, no question, but our primary and principal goal here is to make sure we maintain high quality care and access.
Norm, anything to add?
When the hospital census was perhaps half of what it normally is, we obviously had more healthcare workers here than we needed. A simple example of that is our ICU beds have largely had about 50 surplus beds per day, so we don't need to staff all those beds. When the beds are occupied, of course, we'll provide the normal level of staffing for those patients. And that's true throughout the hospital. So not only is it actively managed, it's managed by site and by census. And we're ensuring by daily reports from the labor pool that the staffing for the healthcare services is completely normal.
Excellent, thank you. I've had this question too. So Bonnie, how can we reconcile that the numbers in our healthcare providers are so low, that 0.4%, with the very high numbers we're seeing on the East Coast? And is it all community spread?
Yes, it's really a heartbreaking situation to see what's been happening in other parts of the country, particularly the high density areas. And we're unfortunately going to see the same thing happen in some of the rural areas and lower density places that have not yet seen the virus and don't have testing capacity. So unfortunately, this is probably going to continue over time. I think the difference is, first of all, we don't know the real answer here, but we can surmise from a number of factors. And the first is that we are seeing most of the cases right now coming from very high density areas. New York City, Manhattan in particular, happens to be the highest density population in the country. And notably, San Francisco is not far behind, but it's a smaller community, and there's much more opportunity to socially distance in San Francisco area compared to, say, the New York metropolitan area, which includes New Jersey and parts of other communities in the Northeast. So we also took different measures here, even though we only started socially distancing 2 days before the New York area did. We also canceled a lot of large events that we think could have contributed to further spread, such as the Chinese New Year parades and St. Patrick's Day parades, et cetera. That was not able to happen in many other communities. So I think there was a lot of community spread. I'm not really sure what happened around the dynamics of healthcare worker transmission within some of these facilities. But if there was lack of PPE available in some settings, then that might have contributed. Certainly community spread had a lot to do with it, though, as well.
Okay, great. So the last question is, how long are we going to be doing these town halls? I have the same question. Right now, we've done approximately 8. However, we've had great participation both beforehand and also during the live questioning. We've had roughly 8,000 people join us every week. So we'll continue to have these as long as you have questions. And I want to thank you on behalf of all of Stanford Medicine for your participation and your attention during these town halls. I look forward to not seeing you next week. Take care.